This is from an article, Frostbite, in the Mayo Clinic's newsletter. Diagnosis. Diagnosing frostbite is based on your signs and symptoms, skin appearance, and a review of recent activities in which you were exposed to cold. Your doctor may order x-rays, a bone scan, or an MRI to help determine the severity of the frostbite and check for bone or muscle damage. Treatment. Mild frostbite or frost nip can be treated at home with first aid care. For all other frostbite, after appropriate first aid and assessment for hypothermia, medical treatment may involve rewarming, medications, wound care, surgery, and various therapies depending on the severity of the injury. Rewarming of the skin. If the skin hasn't been rewarmed already, your doctor will rewarm the area using a warm water bath for 15 to 30 minutes. The skin may turn soft. You may be encouraged to gently move the affected area as it rewarms. Oral pain medicine. Because the rewarming process can be painful, your doctor will likely give you a drug to ease the pain. Protecting the injury. Once the skin thaws, your doctor may loosely wrap the area with sterile sheets, towels, or dressings to protect the skin. Or the doctor may protect your fingers or toes as they thaw by gently separating them from each other. You may need to elevate the affected area to reduce swelling. Removal of damaged tissue. Debridement. To heal properly, frostbitten skin needs to be free of damaged, dead, or infected tissue. To better distinguish between healthy and dead tissue, your doctor may wait 1 to 3 months before removing damaged tissue. Whirlpool therapy or physical therapy. Soaking in a whirlpool bath, hydrotherapy, can help aid healing by keeping skin clean and naturally removing dead tissue. You may be encouraged to gently move the affected area. Infection-fighting drugs. If the skin or blisters appear infected, the doctor may prescribe oral antibiotics. Clot-busting drugs. You may receive an intravenous IV injection of a drug that helps restore blood flow, thrombolytic, such as tissue plasminogen activator, TPA. Studies of people with severe frostbite show that TPA lowers the risk of amputation. But these drugs can cause serious bleeding and are typically used in only the most serious situations and within 24 hours of exposure. Wound care. A variety of wound care techniques may be used depending on the extent of the injury. Surgery. People who have experienced severe frostbite may in time need surgery or amputation to remove dead or decaying tissue. Hyperbaric oxygen therapy. Hypobaric oxygen therapy involves breathing pure oxygen in a pressurized room. Some patients have shown improved symptoms after this therapy, but more study is needed. To care for your skin after frostbite. Take all medications, antibiotics, or pain medicine as prescribed by your doctor. For milder cases of frostbite, a non-prescription pain reliever can help reduce pain and inflammation. For superficial frostbite that has been rewarmed, some people find it soothing to apply aloe vera gel or lotion to the affected area several times a day. Get out of the cold and wind. Don't thaw or warm the affected area if it might refreeze. Remove wet clothes once you're indoors. Seek emergency medical care. Remove rings or other tight items. Try to do this before the affected area swells. Don't walk on frostbitten feet if possible. Don't apply direct heat or rub the area. And don't break blisters that may develop. Blisters act like a bandage. Allow blisters to break on their own. Preparing for your appointment. Call your doctor if you suspect you have frostbite or hypothermia. Depending on the severity of your symptoms, you may be told to go to an emergency room. If you have time before your appointment, use the information below to get ready for your medical evaluation. What you can do. List any signs and symptoms you've been experiencing and for how long. It will help your doctor to have as many details as possible about your cold exposure and to know if your signs and symptoms have changed or progressed. List your key medical information, including any other condition with which you've been diagnosed. List all medications you're taking, including non-prescription medications and supplements. Make a note of the date of your last tetanus shot. Frostbite increases the risk of tetanus. If you haven't been vaccinated or if your last shot was more than 10 years ago, your doctor may recommend that you be vaccinated. List questions to ask your doctor. Being prepared will help you make the most of your time with your doctor. For frostbite, some basic questions to ask your doctor include: are tests needed to confirm the diagnosis? What are my treatment options and the pros and cons for each? What results can I expect? What skincare routines do you recommend while the frostbite heals? What kind of follow-up, if any, should I expect? And what changes in my skin should I look for? Don't hesitate to ask any other questions that occur to you.